Good morning. Now we are going to discuss about the fibrinolytic drugs and antithrombotic drugs. Now, coming to the fibrinolysis. Now it is a process which prevents the blood clot from growing and becoming problematic. Now if there is a blood clot is increasing, it is growing, then it may be the problematic. And especially you can say that this particular in such particular process there is required that there is a degradation or the breakdown of the blood clot. Now this fibrinolysis they usually follows the two process, that is the primary fibrinolysis and secondary fibrinolysis. Now primary type is a normal body process. Clear? It is a normal body process, whereas secondary fibrolysis is the breakdown of the clots due to the medicine or the you can say as a medical disorder or some other causes. So whenever we are going to give the drug and it will cause the breakdown of the clot, that is known as the secondary fibrinolysis. Now as we know that if we remember that coagulation mechanism, the main enzyme which plasmin cuts the fibrin mesh into the various places, leading to the production of the circulating fragments that cleared by the protease or by the kidney and liver. What does it mean? Now plasmin is responsible breakdown of the fibrin, insoluble fibrin mesh. Clear? So if they will cut the fibrin mesh, they will cut the fibrin mesh into the small fragment, and these fragments it will be present into the circulation, and it will be, you can say that cleared by the kidney using the protease. Clear? Using the protease or through the kidney, liver, it will be goes out of the body. Now antithrombotic drugs are used to dissolve, that means break down, blood clot, that is we are calling as a thrombi. Now blood clot can occur at any vascular bed, however they can occur into the coronary, cerebral or the pulmonary vessels. Now in such cases, if this clot occurs into the coronary, cerebral or the pulmonary vessel, they are you can say that they are the responsible for the life-threatening condition. Now coronary thrombi are caused the myocardial infarction, cerebral thrombi may produce the stroke, and pulmonary embolothrombi or thromboemboli can produce the respiratory or the cardiac failure. So whether it may be occurs into the coronary blood vessels or cerebral or the pulmonary vessels, in all such cases this thrombi can cause a life-threatening situation. So it is very important to break down of this thrombi for normalization of the you can say that blood circulation. Now coming to the fibrinolytics. Clear? Coming to the fibrinolytics. Now this fibrinolytics in general, we can say that venous thrombi are lysed more easily by the fibrinolytics than the arterials. So we are telling that venous thrombi, it is lysed more easily by fibrinolytics than the arterials, and you can resent thrombi response better. That means you can say that here we are telling that if the thrombi is more than the 3 days old, if it is the thrombi is new, then they will affect more, but if it is thrombi is more than 3 days, then their effect is minimal. Now clinically important fibrinolytic drugs are the streptokinase, ureakinase and the uh, tenecteplase. So these are the drugs which is used as a fibrinolytics. Now coming to the antiplatelet drug or antithrombotic drug, antiplatelet or antithrombotic drug. These drugs interfere with the platelet function. Yes, these are the drugs mainly they are interfere with the platelet function, and they are more useful you can say that for the prophylaxis of the thromboembolic disorder. That means these are the drugs we can use those who are having the risk of such thrombi formation. So in such cases we can give as a prophylaxis agent. like aspirin, clopidogrel. These are the different important antiplatelet drugs are there. So in the next part of our class, we are going to see about the how these fibrinolytics or the antiplatelet drugs are produced their effect.